leg off. But what you find is if you take a radiograph of this, you're going to see a big fat globule in the middle of the leg that'll tell you that it's actually an intramuscular lipoma. And so with these guys, really important thing is that you make an incision on the skin, and then you separate the muscles, and you put all your sharp instruments away, because the sciatic nerve often runs right through the middle of these. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So, Chloe, I'll have you just hold on to that. And so I can palpate the lipoma there. We've also got a little mass here that I've aspirated, and we're going to have one of the other vets here have a look at it and see if it's a mast cell tumor. So I can take that off at the same time. So making my incision on the caudal aspect of the thigh here. Hopefully I've temporarily fixed the streaming issue. I'm tethering it to my phone, hotspotting it to my phone so that that's actually getting better internet than the wired internet that we have here at the hospital. I'm getting a little bit light, so we'll just give that a minute. It's just got a comment, no lagging now, which is nice. That's because we're on 5G here. So just pull that forward a little bit. That twitching that we're seeing is not the dog feeling it. It's actually the muscle contraction. So the semitendinosus is going to be right underneath where we're operating. So that's biceps up there, and that's semitendinosus right there. All right, so then we'll get our scalpels in here. And if you ever contact me about a tumor case and you say it's shelled out, I'm going to be very sad unless it's a lipoma. Because you can't shell out anything other than lipomas because you'll leave cancer cells behind. So come back down here a little bit. Yeah, so you can just see that lipoma between the muscle bellies. I'm just digging my finger around it. I'm kind of trying to feel the sciatic nerve a little bit while I'm in here with my fingers. Haven't found it yet. Now I did CT this one. The reason why I CT'd it was to make sure that it wasn't infiltrative into the pelvic canal. And it was not. Okay, so sciatic nerve, there's part of it right there. Can you guys see that here? Let's tilt it up a little bit, maybe get a little better lighting in here. And I'll zoom in maybe a little bit. All right, so that's the sciatic nerve right at the tip of my finger, right there. You should be able to see it right up in there. All right, so Now that I know where that is, I know what to avoid.
That is it.
So that's it. Okay. Can I please get some 3O PDS?
On the CT where it looked like the sciatic nerve was running through it.
I beg your pardon?
On the CT where it looked like the sciatic nerve was running through it. So
Yeah.
the sciatic nerve was just running
Right alongside it, yeah. 2O, please. Just grab onto the, you can hand it off to us or drop it on the table for us. So, yes. Make sure the sciatic nerve is not within my clamp. Pull it here. No, it's heading up that way. Great. All right, so where's my suture? I'll just do a ligature around the right angle forcep. Can you just bring that out a little bit? And as I pull this tight, release that clamp. Go ahead and release it. Yeah, thank you. Just get a lap sponge in here to make sure that we don't have any more bleeding. That looks pretty good. And so now I'll just suture the biceps muscle to the semitendinosus. And I'm not going to put a drain in here.
You're breaking them.
Yeah, and I don't know if it's the suture or the needle drivers. Dan Diaz, were you a classmate of mine in vet school? Let me know if you are that Dan Diaz. Philippines. Oh. Not my vet school classmate. Can you just retract that down there? Just take this out here. Maybe just a little bit of retraction. Hold on to that as well. So I'm not concerned about seroma formation here. It's a very vascular area with those muscles close by. I haven't left anything oozing, and so I really don't think that's going to be an issue. Again, drains are going to increase your risk of infection. If you were to use a drain here, you'd want to use a closed suction drain, Jackson Pratt drain or something like that. Definitely not a Penrose drain. I think Penrose drains, in most cases, do more harm than good. They're not effective at drainage. They allow bacteria to wick into the wound. They act like a foreign body. They can break off when you try to pull them out. So the reason why I make my initial skin incision with the blade and then move on to cautery is because I think that electrocautery, given the number of times I've burned myself with electrocautery, I know how it hurts. I think that on the skin it would be quite painful, but then once you get deeper, there are fewer pain receptors, so that's why I move on to cautery. That's just how I've always done it, and I've seen human surgeons do the same thing, and I think that's the reasoning behind it. Let's see if we can move that leg out of the way there a little bit.
Yeah.
Yep, perfect. Yeah. I might do something in the skin as well, just depending on how it comes together. So as I'm live streaming, I've got a little indicator of how good the connection is by the number of dropped frames. And we've dropped 86 frames compared to the last live stream. We dropped 50,000, so I think our internet is a bit more reliable. That being said, when I have a really great internet connection, you don't drop any frames. And I am tacking down a little bit to the underlying muscle here. Just a different set of thumb forceps. This needle is big and I don't want to wreck my delicate DeBakey's. Somebody's saying hello from Poland. Hello, Poland. We don't get a lot of viewers from Poland, at least not on the live streams, probably because of the time difference. So it's just 7 a.m. there. There's a comment that Brooke feels like her incisions heal nicer with less scarring using scalpel versus electric cautery. That's probably fair. Electric cautery does not delay wound healing by very much at all. It delays wound healing by about 6 hours. Can you just grab onto that? Yeah, this suture material. So we're going to have a knot sticking out here. And when I used the proper PDS, it didn't do it. So I think that okay. Very happy with that. That looks great. Might put another little suture up top there. Can I get some more suture, maybe some 2O PDS? So the anesthetic protocol that we use here is usually acepromazine and methadone as a pre-med, and then induction with alfaxan, maintenance with isoflurane. Post-op, most often we use methadone for post-op pain relief, along with a non-steroidal like meloxicam and paracetamol in dogs, and obviously no paracetamol in cats. If I can, like if it's a more major surgery, I'll do some kind of nerve block as well often. So that's pretty much it. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will see you again, hopefully, tomorrow. Did we get somebody to look at that tumor? Do we know?